Hello, I'm Jen. I'm one of the nurses here at PacificSource in the health management department.
And I'm Kat, and I'm also one of the nurses in the case management department.
And we are here today to answer your questions that you replied to our blog post on CAD. So which is coronary artery disease. So one of our first questions is CAD reversible? And the short answer is probably not. There are some studies going on that might show in the future that really strict dietary, exercise, and lifestyle changes could possibly reverse CAD. But what you can do is stop CAD in its tracks by making maybe not quite as strict, but small dietary, lifestyle, and exercise changes.
There's all sorts of diets out there and all sorts of claims. So if you run into an infomercial or something that wants your money and they're telling you that they can reverse CAD, it's best to be a little suspicious about it.
Yeah, maybe check in with your doctor about what you can do and what happens in your life that you can modify to stop the progression of CAD. Smoking, that's a big one.
Yeah.
So the next question we have is, every now and again when I lie down for bed, my heart goes crazy. It's hip hop dancing in my chest. If I sit up for a moment, it's fine again. What's up with that? So what's up with that could be a lot of different things. Yes, having an irregular heartbeat could be a symptom of coronary artery disease or other cardiac issues. And anytime you have something like that makes you feel nervous in particular, it's always the best to go get it checked out. But there are lots of other things it could be nothing, but it's important to get it checked.
Absolutely. Stress reactions or sometimes even sleep apnea. But even those are issues that should be checked out at some point.
Yeah, absolutely. And then the last question we have is there a difference in symptoms for coronary artery disease between women and men? And no, because sometimes coronary artery disease doesn't even have any symptoms. Sometimes it can be small symptoms like maybe you get short of breath when you're exercising, extra short of breath. And sometimes it can go all the way up to chest pain and heart attack. So there's a really broad range of symptoms, and I wouldn't say that there's a difference in coronary artery disease symptoms between men and women. However, heart attack symptoms, there can be a big difference based on gender.
Yeah, women feel heart attacks differently than men. Men, as you mentioned before, have the classic heart attack symptoms where they're clutching their heart, they feel the chest pain that it radiates down to their jaw. Women will have more generalized symptoms like dizziness or vertigo or sweating and maybe indigestion.
Yeah, so if you're feeling like you are having the classic chest pain symptoms or left arm jaw pain symptoms, even if you're a woman, and those aren't the classic symptoms that women get, but it's important to get it checked out. And if you're feeling like you're having a heart attack, call 911, go to the ER, get some help right away. And for coronary artery disease, the best thing that you can do is talk to your doctor, and then look at your life and see what kinds of risk factors you have that you can modify, because even small changes can make a big difference. So thanks so much for taking the time to listen to us today and for submitting your questions about coronary artery disease.